Good day, everyone. I'm Sister Nonhlanhla Lengana, your midwife. Today we're talking your body during pregnancy. As ladies, we need to embrace the changes that come with pregnancy. Love your body, embrace it, because this is a time of change. You're coming into your own and giving birth to a new being yourself as a mother and the baby as well. Therefore, embrace this period. With weight gain, of course, we're talking multiple things that add onto the total weight. So we're looking at your uterus, which is a muscle that would expand to about 1.2 kgs. We're looking at the placenta, which will account for about 0.8. We're looking at the amniotic fluid, which will account for about 1 kilo. The additional blood circulation, that is about 1.5 kgs. Your baby's average weight at birth, that will be about 3.2 to 3.5 kgs. And your additional or increased body fat during this period, which is about 3.5 kgs. So in total, we're looking at about 13.2 kgs of weight gain. But because we are all different, anything between 10 to 20 kgs weight gain in pregnancy is considered normal. With weight gain, we're also looking at the fact that stretch marks come into play. With the stretch marks, you need to use things like almond oil to help keep your body, your skin and body supple. You also need to eat your fresh fruits and veggies to keep a healthy skin. Add your nuts and seeds to that as well to keep your skin very healthy. Keep hydrated by drinking lots of water as well to promote skin elasticity. And remember to pick up weight at a gradual pace. Exercise. It is important to stick to an exercise program that works for you. Remember, we are all different, and your body will be the one indicator that tells you how much it can take during your pregnancy. Therefore, you need to, if you are one that is having a gym instructor, consult with your gym instructor, but it is also important to communicate these things with your midwife and doctor so that you know if you are on the right track in terms of your exercises. If at any given point you experience pain or anything that is uncomfortable, make sure that you stop immediately and you consult your doctor or midwife. With exercise, it is important that we also stick to doing pelvic floor muscle exercises because those will help with what we call stress incontinence. As your baby grows bigger, remember that the bulkiness of the uterus or the womb presses onto your bladder, and every time you laugh, sneeze, or cough, you may find that you pee yourself. Therefore, you will need to do your pelvic floor muscles to help tighten those muscles, and that also is beneficial during your natural birth because those pelvic floor muscles will be ready for natural birth. Moving on to the next thing would be your breast tenderness and also breasts growing bigger. So ladies, we know that with this change, we change a bra size. So you need to make sure that you consult the right people in terms of measuring your breasts and making sure that you get a comfortable bra that will support your growing boobs at this point. The breasts grow in order to prepare for lactation. So with all these changes, you'll need to be comfortable as much as possible. Tight-fitting bras can be very, very uncomfortable, so make sure that you consult the right people to get the right type of bra and size. And then we're talking Braxton Hicks contractions. With Braxton Hicks contractions, these are contractions that we experience as early as 6 weeks. Some ladies will come and say, I have this continuous pain that is there. It feels dull, but it's there. I can feel it. And that is your Braxton Hicks contraction. It carries on throughout your pregnancy until you give birth. This is a way for your uterus to keep toned in pregnancy. So therefore, it will keep on contracting. And these are contractions that will last anything between a minute to 3 minutes on average. But these are tightenings that are quite normal in pregnancy because this is just your uterus pre-practicing for what is to come. As well as consulting your doctor should these pains get worse than normal, than what you can handle. When you sit in warm water, when you change your position, we expect this pain to go away. But if this pain does not go away when you do these things, then you'll need to see your doctor or midwife so that they can intervene accordingly and help you during this period. We're also talking swelling. The swelling a lot of times tends to happen late in pregnancy, around your 3rd trimester. That's when a lot of people tend to have a bit of swelling in pregnancy, where you find your hand and feet swell quite a bit. This is one of the normal things that happens in pregnancy due to the increased blood circulation. But there's a condition that comes as well with the swelling in pregnancy called carpal tunnel syndrome. You will need to consult your doctor if you're feeling pain around your wrists and you feel tingling sensation, especially when you wake up in the morning, where you cannot wring your face cloth when you want to maybe wipe your face or anything like that, and you feel a lot of pressure in your hands. You'll need to consult your doctor so that they can be able to intervene accordingly. A lot of times what is recommended when you're having this pain is to wear wristbands to help support your hands during this period, so as to help reduce the uncomfortability. We're also looking at nausea and vomiting. Nausea and vomiting are one of the things that happens for some people throughout the pregnancy, but for some it will only happen within the 1st trimester and only come back the last trimester of pregnancy. So during the 2nd trimester of pregnancy, you'll find that they have nothing. When your nausea and vomiting carries on throughout and it gets to be excessive, that condition is called hyperemesis gravidarum, and this is when now you will need to see your doctor so that they can intervene accordingly and hydrate you. But for you, there's things that you can do to help in terms of minimize and reduce the nausea and vomiting as well, the nausea specific, where you will eat things like ginger roll, try and eat as well as dry toast, just to help, keep the nausea at bay. And avoid things that makes it worse. Heartburn also comes into play. This is now late in pregnancy, where you'll find that as your baby grows bigger, they push your stomach content up, and now you have that burning sensation that you have like indigestion. So therefore you will need to either, do your home remedies like drinking chamomile tea, eating slowly, chewing your food properly, making sure that you do not drink fluids with the food, but you drink afterwards, so as to alleviate the heartburn. If the heartburn gets excessive though, you will need to consult your doctor or midwife so that they can be able to prescribe medication for you that can help with alleviation of that heartburn. As well as avoiding lying down immediately after eating, because that can make it worse. Thank you so much. That is all for today.